You're listening to Oral Surgery Insights. I'm Dr. Russ Lieblick with Dr. Rehrer. Brandon, it's a constant challenge in our field, isn't it? Helping patients sort through the sheer volume of information and misinformation that they encounter, especially online.
It's a huge part of modern practice. And for a topic like dental implants, which is a significant and important decision for patients, those online myths can create a lot of unnecessary anxiety and confusion before they even come in for a consultation.
And that's our entire focus today. We want to take some of the most common myths we hear about dental implants and address them head on, replacing them with clear, factual information so listeners can feel more empowered.
It's a fun conversation. Dental implant therapy is one of the most successful and predictable procedures we have, and decisions about it should be based on sound information, not on fear or outdated ideas.
I think the biggest and most pervasive myth we encounter is that getting a dental implant is an extremely painful experience. That fear of pain is a major hurdle that prevents many people from even exploring the option.
It's a completely understandable concern for any surgical procedure. Let's be very clear about this. The surgical placement of a dental implant should not be painful. The procedure itself is always performed with excellent local anesthesia, which completely numbs the area.
Patients might feel some pressure or vibration during the procedure, but that's about all.
And for any patient who has anxiety about the experience itself, we have a full spectrum of sedation options. We can tailor the level of comfort to their specific needs, from mild relaxation with nitrous oxide to IV sedation, where they can comfortably sleep through the entire process.
That brings up the other part of the pain question, the recovery. What can patients expect after they go home?
Well, that's the best part. If the procedure is done by an experienced oral surgeon, there should be almost no pain with implant placement. For a single implant, the recovery is much easier than that of a tooth extraction. Most patients find that a schedule of over-the-counter anti-inflammatory medications, like ibuprofen, is more than sufficient to manage the soreness. If we extract a tooth or do some kinds of bone grafting, it can be mildly sore for a few days, but it usually doesn't slow anyone down.
We often hear from patients a day or two after their surgery, and they are almost universally surprised at how much better they feel than what they had anticipated. A well-planned, minimally traumatic implant placement is a very controlled surgical procedure with a very manageable recovery for most people.
Another myth we frequently need to correct is the idea that dental implants are often rejected by the body, or that they have a high failure rate.
That word rejection can sound very alarming to a patient.
It can, but it's not biologically accurate in this context. Rejection is an immunological response, like what can happen with an organ transplant where the body's immune system attacks the foreign tissue.
But dental implants are made of medical-grade titanium.
Exactly. Titanium is completely biocompatible. The body does not recognize it as a foreign invader and does not launch an immune attack against it. So, implants are not rejected.
The correct term for what can happen, although it is infrequent, is a failure of the implant to fuse with the bone, a failure of osseointegration.
Correct. And it's important to put the success rates in perspective. Decades of research and clinical data have shown that for a healthy patient, when an implant is placed by an experienced surgeon using modern techniques, the success rate is typically about 96%. Our practice is currently seeing 98.3%, so we're happy to be beating the statistics.
That's one of the highest success rates of any implanted medical device, and that high rate of success is a direct result of careful planning. We thoroughly evaluate a patient's medical history, use 3D imaging to assess the bone with precision, and use sterile surgical techniques.
Patient factors, like uncontrolled diabetes or heavy smoking, can increase the risk of complications, and that's part of the conversation we have during the consultation. But for the vast majority of patients, success is the highly predictable outcome.
Let's talk about aesthetics. A common concern we hear is the myth that a dental implant will look fake or be easy to spot. This is especially true for patients who are missing a tooth right in their smile.
The reality is that a well-done dental implant restoration should be virtually indistinguishable from a natural tooth. A key thing to remember is that the implant itself, the titanium post, is completely hidden below the gum line. It's the artificial root, but it has to be done correctly. As surgeons, we set the stage to help our restorative colleagues to make it pretty.
What you see is the final crown, which is the tooth part. And that crown is custom fabricated by a highly skilled restorative dentist and a dental laboratory technician.
They meticulously craft the crown to match the exact size, shape, and color of the patient's other teeth. They can replicate translucency, surface texture, and all the subtle characteristics that make a tooth look natural. We always recommend custom milled abutments, the connector pieces, that are shaped to allow the gum tissue to heal around them in a very natural way.
It creates a seamless transition from the gum to the crown, so it doesn't look like a tooth is just sitting on top of the gums. The end result is a restoration that blends in perfectly with the rest of the smile.
Another myth that can unfortunately discourage patients from seeking care is the belief that they might be too old to get dental implants.
We hear this one quite often from our older patients, and it's a myth we are always very happy to debunk. There is no upper age limit for dental implant treatment.
Yeah, we hear this all the time. The decision is based on a person's overall health and their desire to have a naturally functioning dentition, not their chronological age. We have successfully placed implants in many healthy patients in their 70s, 80s, and even into their 90s.
My oldest dental implant patient so far was 99. The main questions are, is the patient healthy enough to undergo a routine surgical procedure, and do they have adequate jawbone to support the implants?
And even if there has been some bone loss over the years, which is common, we have very predictable bone grafting techniques to rebuild the necessary foundation.
For many of our older patients, dental implants can be truly life-changing. They can restore the ability to eat a wider variety of nutritious foods, improve speech, and eliminate the discomfort and instability that often come with removable dentures. The improvement in quality of life is profound.
How about maintenance? There's a misconception that because implants are artificial, they don't need much care.
Or the opposite, that they require a lot of special, difficult maintenance.
The truth is quite straightforward. The maintenance for dental implants is very similar to the ideal care for natural teeth. The implant and crown can't get a cavity, of course.
But the health of the surrounding gum and bone is absolutely crucial for the long-term success of the implant. Just like natural teeth, implants can develop problems if plaque and bacteria are allowed to accumulate around them, which can lead to inflammation of the gums or even bone loss around the implant.
So, the required maintenance is normal, adequate daily home care. This means brushing twice a day and, very importantly, cleaning between the teeth and around the implant. This might involve traditional floss, or often tools like a water flosser or small brushes that can effectively clean the implant surfaces.
And just as with natural teeth, regular professional checkups and cleanings with their general dentist and hygienist are essential. It's not difficult, but it is necessary for long-term health.
One final myth we should address is the idea that a traditional dental bridge is just as good as an implant.
We often hear this in the context of it being a faster or less expensive option initially. While a bridge is a valid way to replace a tooth, it is fundamentally different and has significant biological trade-offs.
The most significant of these is the need to prepare, or grind down, the often perfectly healthy teeth on either side of the missing tooth space to support the bridge. This is an irreversible procedure that can make those teeth more prone to future problems.
An implant, in contrast, is a standalone solution. It replaces only the missing tooth, leaving the adjacent healthy teeth completely untouched and unharmed. This is a huge conservative advantage for the patient's long-term oral health.
Furthermore, a bridge does not stimulate the jawbone in the area of the missing tooth, so bone shrinkage will still occur under the fake tooth part of the bridge.
An implant, by fusing with and stimulating the bone, prevents this from happening. So while a bridge can be a good solution in certain situations, it is not functionally or biologically equivalent to a dental implant, which more closely mimics nature's own design.
So, Russ, it's clear that a lot of what people fear or believe about dental implants is often based on outdated or simply incorrect information.
It is. The reality is that modern dental implant therapy, when planned and performed by an experienced specialist, is a highly predictable, safe, and comfortable procedure with exceptional long-term success rates. The final results look and feel incredibly natural.
Age is not a barrier for healthy individuals, and the maintenance is similar to caring for your natural teeth. When we look at the evidence and the long-term benefits for a patient's health and quality of life, the value is clear.
The most important thing for anyone considering this option is to seek information from a credible, expert source. Have a thorough consultation, ask questions, and make your decisions based on facts, not on myths you might find online. We hope this discussion has helped to debunk some of those common misconceptions. Thank you for making Oral Surgery Insights part of your day.
We appreciate you listening, and we trust this conversation has provided valuable clarity.
We wish you all the best.